2022, the National Assembly repealed the Act establishing the National Health Insurance Scheme and replaced it with the National Health Insurance Authority Act 2022, which has since been assented to by President Muhammad Buhari. But the question is, how effective has the agency been? Well, Arise correspondent Georgina Unduke Zainka tells us more.
Since the National Health Insurance Scheme was passed into law, millions of naira has been put into the scheme, but sadly, many Nigerians still lack access to quality healthcare services. In a 2021 survey by NHIS polls, about 8 out of 10 Nigerians do not have health insurance cover. As the World Health Organization puts it, continuous out-of-pocket payments for medical treatments can further increase the level of poverty that already exists in the country. While the signing into law of the new National Health Insurance Authority Bill 2022 by President Muhammad Buhari is part of efforts to address this and ensure total health coverage for Nigerians. President Buhari says the new National Health Insurance Authority that replaced the National Health Insurance Scheme will collaborate with the state government health insurance to accredit primary and secondary healthcare facilities and increase the enrollment of Nigerians. However, there are some concerns. The previous health insurance scheme was in 2018 enmeshed in a corruption scandal. Now the question is, will the new legal framework for the agency rid the agency of acts of corruption? Will Nigerians now begin to enjoy adequate service delivery? When will the scheme begin to cover treatments for life-threatening ailments too expensive for individuals to pay for? These questions will remain a rhetoric until the agency lives up to its responsibility. Georgina Ndukwezainka, Arise News.
Joining us now is the Director General of the National Health Insurance Scheme, Mohammed. Nasir Sambo is the DG of the authority. Very warm welcome to Newsnight.
Thank you for having me, sir.
How revolutionary would you say the new act has helped in deepening access to health insurance in Nigeria?
Thank you very much for this question. I think there are some fundamental principles that ought to be understood if any meaningful conversation will go in discussing health insurance. If we lose those principles, I don't think if there will be any good understanding. So we'll continue to have reporters reporting things that are not very clear to people. Number one, health insurance is not a free healthcare services. It is a program that ought to be paid for. Either you pay for yourself or somebody should pay for you. Number two, wherever you see government establishing social health insurance, is normally a social system that is contributory. There are so many mechanisms of financing healthcare delivery system. You can finance healthcare through general tax revenue. You can finance healthcare through donor financing. You can finance healthcare through earmark taxes, and so on and so forth. But when you are talking about health insurance, you are talking about a scheme that is established to alleviate suffering from financial hardship in seeking for medical care. You can quickly discern two types of health insurance. One, the social health insurance. Number two, the private health insurance. Wherever you see social health insurance, you are looking at an effort of government to bring about a system that can support, especially those who cannot afford. The private, on the other hand, the private health insurance is an arrangement by a private sector, which is likely a profit-oriented system. Another thing, one cardinal feature of the social health insurance is cross-subsidization. What is cross-subsidization? When you have a group of people that have different, epidemiology or exposure or socio-economic status, coming together to contribute into a health insurance pool. For example, you have a director in an organization contributing proportion of his salary,
yes.
and you have a messenger contributing his own proportion of the salary, and is put into one basket. Based on the epidemiological trend of diseases, if you look at the distribution of disease in human population, it is done in a way that it is not everybody that will come with a healthcare problem at the same time.
Yeah.
And it is not everybody that will come with the same kind of healthcare problems.
Indeed, and that's why it's a pool of risk.
Risk, and
yes.
Of
course.
And full of risk and full of resources.
Yes. So let me ask you, because one of the major difference, some people will say, between the law that exists now for the authority and the scheme is that there was a special vulnerable group fund that was expected to be set up. Mr. President did say that much when he was signing it into law, that for vulnerable individuals, a group fund would be set up. Now, what is the financing mechanism for that? Because that's supposed to cover vulnerable people, including children, pregnant women, old people, and mentally ill Nigerians. So tell us about that. Has it been set up? And when you say yes, it's not free. It's not free indeed, but with this authority in place, did the president not set up something that should help the most vulnerable in Nigeria? Tell us about that.
I have not even answered the first question. You have jumped to the second question. So if that's how you want it, then let's move on. I want to start by commending Mr. President for signing this a legacy law, because for in the past 24 years, there has been a lot of efforts to get this the initial law to be amended, but it was not possible until May 19th, 2022. So this law has two very distinct features. Number one, it makes health insurance mandatory. Wherever you want to ensure that health insurance covers the entire population, it has to be mandatory. And the other law that has been repealed, the NHIS law, was not mandatory. So even in the best of efforts, there is no way it will cover Nigerians. So the 2% that is being shown is not surprising, because it can only accommodate probably people at the federal government who are employees of the federal government, civil servant, and some private sector that are willing to join, because it's not made mandatory. But now that is made mandatory, then we are expecting so many people to come. And one of the features of health insurance that I was talking is a pool dependent. The bigger the pool, the more ability to generate the fund that can provide for sufficient healthcare delivery.
Well, that's exactly the point I'm coming to, is if the scheme, we just heard that 8 out of 10 Nigerians, don't have access to it. Is this new act creating that access? We're looking at the downtrodden people, the really poor Nigerians, 100 million of them, which Mr. President planned to take out of poverty. Is it giving Nigerians access to quality health care right now?
Absolutely. That is the intention of the law. The intention of the law, as I said, is mandatory. And number two, it makes provision for the vulnerable group funds. Because in a population, there are people that, no matter what, they cannot afford. And those are the vulnerable that has been put by the Lancet Commission report that is about 83 million people. And if you look at the current figure of the vulnerable, according to the Office of Bureau for Statistics, is putting it as almost 100 million plus. So these people, for you to be able to achieve the objective of universal health coverage as espoused by Sustainable Development Goal, government has to make effort to cover this vulnerable segment of the population. And it is not Mr. President that will set off the fund. The law has already set off the fund, and Mr. President has assented to it. It is now our responsibility as an agency to create enabling mechanism because the mechanism or that funds can be generated has been clearly outlined. Number one, we all know about the existence of Basic Healthcare Provision Fund, which is a vulnerable group programs that is currently being implemented. So that fund will now be subsumed into the into the vulnerable funds. Number two, there will be health insurance levy. What is this health insurance levy? We have seen in many countries that have been able to attain universal health coverage an effort of innovative financing, where there is any opportunity through an innovative mechanism that can drive fund into the national health insurance. For example, there is this popular mechanism, 1 kobo per second call in telecommunication. Yeah. That is encapsulated in the law before it was removed. It was because it was removed and for the president to sign. The argument by Ministry of Finance, NHIA is not a revenue generating agency. Yeah. Therefore, that function is the function of FRAS. So, in a country where we have seen that they have reached a very good trajectory in attainment of universal health coverage, we see them developing this innovative financing. For example, in Nigeria, there is what is called SSB tax, sugar, sweetened, and beverages tax, which has been approved in the Financial Act. And we are having a lot of conversation with the Ministry of Budget to see how large chunk of that amount of money can come into the national health insurance. So if that fund is a proportion of it is dedicated to the health insurance, it is assumed to be a health insurance levy. If we are able to succeed through constant dialogue to achieve that 1 kobo per second call that can come into the fund, is another innovative financing. So through various innovative financing means, which we have already now inaugurating a committee that can look at all the potential sources of deriving resources to go into that vulnerable fund. Because the thinking to be able to generate that fund and to ensure that it's not in conflict with any subsisting law will require a lot of stakeholders coming together.
Absolutely.
We have constituted that committee, and they will start their work to come up with recommendations that can be presented at Federal Executive Council that it can make the fund.
Authority. It does look like you have your work cut out for you. I mean, it's almost a year since the president assented to this bill, making it law. We really wish you the best, and we're watching the growth of the authority, the agency behind all of this. Thank you so much.
Thank you so much.
The National Health Insurance Authority,
the Director General, Professor Mohammed Nasir Sambo.
Thank you.
Thank you very much.